Welcome to Hands on Health, the podcast all about living your healthiest life on the coast. I'm your host, Felicia Struve, and in this episode, I'm joined again by physician's assistant Emma Todd from the CMH Primary Care Clinic in Astoria, Oregon. Today, we're talking about catching breast cancer early. Join us for episode 3 of Hands on Health. Hi, Emma.
Hi, Felicia. How are you today?
Welcome. I'm good. How are you?
I'm good.
Good. Well, it's nice to chat with you again. And now that we're recording this, it is October 16th. So we're halfway through Breast Cancer Awareness Month. And it's a good time to talk about it since it's on people's
Absolutely.
minds.
Yep.
Well, you know, in a normal year, we'd have like pink ribbons everywhere. And it's definitely not a normal year this year. But why? I mean, we're in the middle of a pandemic. Why should I care? Why should I still be concerned about breast cancer?
That's a really great question. So breast cancer is the most common type of cancer that women get, and it's the leading cause of cancer-related deaths in women worldwide. So pandemic or not, I think it's a thing that women should be worried about.
Well, I know years ago, when I was in college, we were told do self-exams once a month. And of course, that I don't always keep up with that. But is that still the best thing for women to be doing?
So the guidelines have changed in the last couple years. It used to be definitely see your provider for yearly clinical breast exams and make sure that you're doing your monthly self breast exams. And of course, I would never discourage a woman from still doing a self breast exam. But it's really important that women understand that the best way to detect breast cancer is with a mammogram. Generally, by the time your doctor or you can feel something in the breast, it's already larger than we would have been able to see with the mammogram, meaning that the mammogram would see it much, much, much earlier. So definitely want to make sure that you're getting your mammograms. And then if you choose to do self breast exams as well, that's great.
But I can give up on feeling guilty about not doing it. That's what I'm hearing.
Yes, please do
Okay.
not feel guilty.
Okay, good.
Yeah.
Well, so if I'm not doing the self-exam and I need to be getting mammograms, is it still 40? Because that's when my mom started getting them.
Yeah, so there are a wide variety of guidelines across medicine that basically tell providers when they're supposed to order things like a mammogram or a colonoscopy, how to screen for prostate cancer, all these types of things. So lots of different organizations have their own ideas about when these things should happen. And different providers will use a certain guideline. So different providers may have different ideas. Me personally, I use the USPSTF, which is the US Preventative Services Task Force, and they look at also different sorts of issues and then make recommendations on how we should screen people or manage these things. And according to those guidelines, for a woman of average risk, which would be someone who has never had breast cancer herself, does not have a first-degree relative with breast cancer, has never had any radiation therapy to her chest area, she would begin screening at age 50 with a mammogram every 2 years. And then if you want to get a baseline at some point in your 40s, you could certainly do that. The recommendation, according to USPSTF, would be to do that towards the later 40s. So generally, I would say 45 would be a good time.
Can I ask you a question? You said a first-degree relative.
Yeah.
So my first question is, who's a first-degree relative? And then the other one was chest radiation. So does that mean if I've had a chest X-ray, then I should get an earlier mammogram?
So those are both great questions. So first degree relative would be like your mom or your sister, for example. And then for chest radiation, so what I mean when I say chest radiation therapy would be like if you had had some sort of like radiation therapy to the chest. So not just a chest x-ray, not just a chest CT, but like if you had had some other kind of, like chest cancer and you had had like a radiation therapy to that area, for example.
Okay. Okay. So if I haven't had breast cancer myself, if I don't have a mother or a sister who has had breast cancer, and if I've never done radiation therapy in my chest, then I can err on the side of later. Am I getting that
Absolutely.
right? Okay.
Yes, you are.
So, well, when should I get it earlier?
Yeah. So, I mean, so like I said, in that scenario, you would be considered average risk. And so those women would want to start around age 50. Um, the next step from that would be a woman of moderate risk, and they would start at age 40. And so that would be the woman whose mom or sister had breast cancer, that wasn't BRCA positive. So BRCA is a specific gene that is identified as being positive in women that have breast or ovarian cancer, and it makes treatment of those specific cancers more difficult. It also makes it more likely that other people in your family will have that type of cancer as well.
Okay. So what you're saying is that the reason why the first degree relative thing matters is because it could actually be a genetic predisposition to having breast
Mm-hmm.
cancer? Okay.
Correct.
Is that why we hear about celebrities just having preventative mastectomies and that sort of thing?
So in that case, that's most likely a woman who has a relative that had breast cancer that was BRCA positive.
Okay.
In those cases, like I said, those cancers are much more aggressive. They're harder to treat. And the likelihood, like if I had a mom that had a BRCA positive breast cancer, the likelihood that I would also have breast cancer is much higher. And then the
Mm,
cancer that I would get would be much more difficult to treat. And so, yes, some women will choose to have what we would call a prophylactic mastectomy, which is like they would have the surgery to remove the breasts in order to protect themselves from ever getting that cancer. That would be the hope, at least.
okay.
Yeah.
Okay. So, who is high risk then? So you've talked about average risk and moderate risk. Who's high risk?
So high risk is that woman whose mom had the BRCA positive cancer,
Hmm.
and any woman who's had breast cancer herself in the past or has had that chest radiation therapy. Okay, so not just a chest x-ray, but the actual radiation therapy to the chest.
Okay. And when should they start getting mammograms?
They should probably be starting earlier than 40, but it really depends on it's more individualized at that point, is what I'm trying to say. And generally, what will happen is they'll have a yearly screening, usually with a different method. So that might be like a breast MRI. Okay. And they'll usually be followed by an oncologist or a breast surgeon or some other high risk clinic.
Okay. So it probably not too many people fall into that category.
Probably
But
not. Yeah.
going back to like average risk, do you still get a mammogram every year? Let's say I start at 45. Am I supposed to do it every year or is it every other year? How does that work?
So majority of women will fall into that average risk category. And according to the USPSTF, the mammogram should be every 2 years, starting at age 50. Okay.
Okay.
Some providers, this is a discussion that you may have with your provider. Your provider may suggest that you do it every year. Other providers may suggest every 2 years because, as I mentioned, there's lots of guidelines. So there's lots of different recommendations that providers can follow for this. So one answer isn't necessarily better than the other.
Okay. So a mammogram, that seems to be like the gold standard.
Mm-hmm.
But are there times when a mammogram isn't the best way to be looking for cancer? You mentioned an MRI a few
Mm-hmm.
minutes ago.
Yeah. So, in certain circumstances, a breast MRI or a breast ultrasound might be recommended. Those imaging studies allow us to get a different look at the breast tissue. Okay, so a mammogram is like a special X-ray where they compress the breast and then they take like an X-ray of it. But sometimes if a woman has had cancer in the past or if she has very dense breast tissue, then something like an ultrasound or an MRI will allow us to look better at the breast tissue.
So how do I know if I have dense breast tissue and need something different?
Yeah. Usually what'll happen is you'll have a mammogram and then the mammogram will say that the breast tissue is dense. You won't necessarily know that yourself. It's not like you're going to feel your breasts and they're going to feel rock hard. If they do, that's concerning, and you do want to talk with your provider about that, okay? But usually your breast tissue will just feel normal. But when they go to compress it and take the x-ray picture, it'll look different to the radiologist, which is the doctor who looks at the x-rays. And so they'll be able to tell that your tissue is more dense, and then they'll recommend like a breast ultrasound or a breast MRI so they can get a more complete picture.
Well, what about women who have something unusual like implants? Can
Mm-hmm.
they do a mammogram as well?
They can, yeah. Oftentimes, they will also be recommended for a follow-up breast ultrasound or breast MRI, just as a woman with dense breasts would, because sometimes the implant itself can make it more difficult for the X-rays to like it's the way that X-ray works is that the actual like rays go through the material, and so the implant itself is sort of like opaque for or
Mm.
difficult for the x-rays to go through. And so then they don't get as good of a look at the tissue. And so following it up with something like an ultrasound or an MRI allows them to see it more clearly.
Okay, so like just a silly analogy, it's like shears and blackout curtains. Like,
Exactly. That's not silly.
okay,
That's perfect. Yes, exactly.
okay. So I know that a lot of people are feeling overwhelmed right now. And, let's say you're 40 and your mom had breast cancer, or you're 45 and you've never had a mammogram before. People are feeling overwhelmed. What would you tell somebody who is feeling like getting a mammogram is just one more thing and I don't want to worry about it? Can she wait?
That's such a good question, Felicia. And I think it's really applicable to the time that we're in right now, where there's a lot of stress and anxiety for people because of the pandemic, and our lives are all completely different now. I think what I would say is that depends. And really, that question warrants a discussion with your provider who knows you best and knows your certain circumstances. Because if it's really going to be that huge of a burden, maybe now is not the best time to look, maybe in 3 or 4 more months. But that always carries the caveat of if there is something that's going on that we need to follow up on, that follow up would be delayed. So I think it's a balancing act. And I think that's definitely a discussion that should be had with your provider.
Well, it sounds like just a continuation of the lot of women, right? Balancing everything in life and
Yes,
including your health.
absolutely. Yes, of course. I think that our health is the most important thing. And so anything that you can do to try to promote that and make it better, you definitely want to pursue. And so I would recommend that those women have the mammogram anyway, but again, that's a discussion that I think she'd want to have with her provider to sort of flush out the pros and cons.
Well, great. Thank you so much for joining me today and
You're welcome.
telling us all about mammograms and when we should get them and why it matters.
Absolutely, Felicia. It's my pleasure.
Thank you for joining us today. I'm Felicia Struve, and this has been an episode of Hands on Health, brought to you by Columbia Memorial Hospital.